Right, I'm making this video for our group, Perimenopause Hell. And today we have Dr. Sanjay Gupta, and we're going to ask him a few questions about palpitations and heart health when it comes to this time of our lives. So, Dr. Gupta, can I ask you first about palpitations? Because that's something a lot of the ladies in the group they get very, very concerned and worried about it. They have feelings like their heart is skipping a beat quite often, or they describe it as flip-flopping about, or they have the racing heart. And they wake up in the middle of the night with hot flushes and night sweats and, boom, 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 boom. Is this something that they should be worried about?
Well, the first thing to say is that, heart palpitations are a symptom, okay? It is when you feel that your heart is doing something it shouldn't. And broadly, they can be divided into two groups. You feel that your heart is doing something it shouldn't be doing, but actually your heart is behaving fine. Or truly, your heart is doing something it shouldn't. And the first thing to try and do is whenever someone complains of palpitations, it's nice to try and clarify that. Is it a heart problem, or is it a brain problem or an environmental problem, rather than the heart being intrinsically doing something wrong? And the way you do that is when you have the palpitations, if you can do an ECG at that time. So if you have some kind of monitoring of the heart done during the palpitation, then you can tell. It is also true to say that there are lots of, there are some heart rhythm disturbances which occur in normal people, which have felt like skips and misbeats. These are normal findings, but in some people, they notice them a lot more. And that often, in my experience, tends to be more noticeable in people who carry a degree of anxiety, So when I'm talking to people, I think I've spoken to about almost 3,000 people now with skips and etc. And by far and away, the majority of them will say, and I tend to be an anxious person, etc. I'm not saying that it is anxiety. I'm not suggesting that they're making it up at all. What I'm saying is that it is just my observation that there is a very high prevalence of anxiety in the group of people who notice these skips and flutters, which are actually a normal finding in healthy volunteers who don't notice it.
I agree with you. I completely agree with you, because a lot of the women in our group do say that they have anxiety. And particularly, I think, with the changes in hormones, that in itself can cause anxiety as well. So I think with the anxiety, it's more noticing things that other people might find normal and not pay attention to at all. It's a lot of women in the group also have health anxiety in particular, so they're kind of paying too much attention to what their body's doing. So they might be noticing their heartbeat, paying too much attention to it, perhaps.
There was also an interesting experiment done once where they took a bunch of people who had health-related anxiety, strapped them to a heart monitor, and then went on and asked them anxiety-provoking questions. So if you take someone who has a degree of anxiety and you make them more anxious, you actually see more skip beats and ectopics on a monitor. So they feed off each other. Palpitations, skip beats, etc., cause anxiety, and anxiety causes more.
Wow, that's really interesting. Yeah, apparently you can kind of train yourself to slow your heart rate down and stuff if you use a monitor. I think some people have done it with Dopplers and stuff, that they can, if you sort of try and go and really kind of calm yourself down, you can do that.
There was another interesting experiment done, I think, in London, where they took a bunch of healthy volunteers and they made them hyperventilate. So if you strap them to a heart monitor, make them hyperventilate, it was very interesting because a lot of them got these extra beats and skips, ectopics on a monitor. So maybe one of the links between these is the breathing patterns and the fact that when people get more and more worried, they don't actually breathe as efficiently. And in some way that can affect the calcium and magnesium levels in our blood stream, and it can move calcium and magnesium from outside the cells into the cells, making people relatively deficient outside the cells, and that's why people will get some tingling in their hands, they can get some perioral numbness, and that is very much one reason. And perhaps we'll get onto it later, but that may be one reason why magnesium seems to benefit certain people.
Yes, I was going to ask you if there's anything particular about this time of life that can cause heart problems.
Well, the first thing is, when there's tons of stuff that goes on as a person gets to that age. One, hormonally, the change of hormones, wherever there's hormonal change, people tend to notice more. So during pregnancy, a lot of people who get ectopics or skip beats tend to notice them around ovulation time. And certainly menopause is also one of the times when people get these. It is also important to say that it may also be hormonal, but it's also a difficult time in general. Children are leaving home. It's a difficult time for women that age. You're somehow confronted with this idea that you're getting a bit older, and that's a scary time as well. So there's a lot that goes on, which could explain why they're more prevalent around about that time. You just end up feeling a little bit more vulnerable, and everything feeds off each other. And that would be the reason, really. It isn't so much so that age group, although they're a little bit older, it isn't the kind of typical age group where you actually start seeing heart problems. Usually slightly older women would start getting the kind of heart problems that we expect to see, heart attacks, etc.
So would you divide that into, say, postmenopausal women rather than perimenopausal women?
Yeah, absolutely.
So
absolutely.
What exactly is the difference when estrogen levels start to decline? What effect does that have on the cardiovascular system?
I think the first thing to say is this question about estrogen and the cardiovascular system is a really difficult one, because the studies haven't been very clear. For a long time, people thought that estrogen was a very good thing as people got older. It lowers your cholesterol levels, it lowers your triglyceride levels, it may have an anti-inflammatory effect. So in that sense, doctors were using estrogen. Then a couple of studies came along. I think it was the Women's Health Initiative. There were these studies which suggested that there was worse outcomes when you treated women with hormone replacement therapy, and therefore HRT became very unfavorable. But subsequently, when people started looking at that in a bit more detail, and they did some secondary analysis, they found that it was women who were much past the menopause, so 10 years down the line, that were getting the problems, not the perimenopausal group. And in general, the evidence is that HRT will reduce blood pressure. It makes for a more favorable lipid profile, etc. Having said that, I don't think there is any convincing evidence at this point in time that it should be taken for its cardiac benefits. It should be taken for its benefits in the perimenopause time with the symptoms of perimenopause, not be prescribed for long-term heart protection. So if someone came to me and said, oh, I'm really struggling, but they say HRT is bad, I'd say, no, you don't need to struggle, have HRT. But if someone came to me and said, should I start on HRT because it'll reduce my risk of having a heart attack, then I wouldn't necessarily do it for that.
Yes, I think that's probably, I would agree with you in terms of that advice. I think it's very good for getting you through the immediate difficulties of adjusting to life with lower estrogen. Yes. So if you're having symptoms that are really, making your day-to-day life very, very difficult, then HRT is a brilliant thing for the short term. But you have to work out whether you're prepared to accept the risks, because obviously there are risks. So going back to magnesium, a lot of women in my group, there's this absolute mania for magnesium at the moment, and it's a very fashionable kind of thing. It's all like, I've got this wrong with me, oh, take magnesium for broken legs, magnesium will It's really, it's quite incredible. And different types of magnesium will do different things. We often see this meme that pops up on the group, take this type of magnesium for heart problems, take this type of magnesium to help you sleep at night or whatever. And I don't particularly go along with different types of magnesium, but anyway, what is your opinion as a proper doctor on, whether magnesium's good for your heart or whatever?
Well, the first thing I would say is that there are two aspects to any kind of thing you take, because life itself has only two aspects. There are only two dimensions. One is quality and the other is quantity. I don't recommend anything to be taken because in some way it will make you live longer unless I have some definitive proof from a research study which has looked at that, confirming that. So when you're trying to prescribe medications or take medications for their benefit in the long term, you have to be guided by evidence, because you don't know. You will never know. You can take magnesium all your life. How do you know whether you've lived longer as a result of taking it or not? So I don't recommend it for length of life purposes, but quality of life is a very
it's for various symptoms. Will it help with these heart palpitations?
Well, I put a poll out and 75% of people who responded out of about 600 said, yes, I feel better. It has improved my quality of life in some way. It makes my heart palpitations less. But a lot of people also come back and say, oh, my night cramp is gone. I sleep a bit better. I think it's just calmed me down. And then I say, well, we know if it's affordable to you, and we know it's not dangerous, and we know a lot of people are deficient, not that I look for it, then, and it has improved your quality of life, then go for it. Keep going.
Yeah, it's harmless enough, isn't it?
Absolutely. And if it, ultimately, it doesn't really matter how it does it. If someone says, I feel a bit rubbish and I've now started taking this and I feel a bit better and I know it's not dangerous and I can afford it and there's no issue, then what's the harm?
Yeah. So how much of that do you think is really the placebo effect?
It depends on what you mean by placebo. What is placebo? Is placebo something that doesn't work? Clearly, in these people, it does work, right? They come back and they say they're happy. That's all you want.
Yeah, I agree.
Your medications may be placebo. How many of allopathic medications may be placebo? So I am all for it. The problem is you will never get a proper study on magnesium because no one was going to make any money out of magnesium. They would much rather advocate these kind of really expensive, wonderful new drugs which are expensive and have side effects, etc., rather than look at kind of things like magnesium. But I am a complete convert. I would recommend it to everyone because I really find that when people come back, they say, I'm so glad you recommended this. I feel better. And I would recommend it wholeheartedly.
Okay, well, that's great. I do say to women, try it, because lots of women in the group do say that it helps and so on. So why not? I have never read anything that says it's has any concerns around taking it. There's no bad side effects apart from the laxative effect if you take too much.
Yeah, absolutely.
Yeah. So going back to my list of questions for you, you think that palpitations are mainly to do with anxiety. There's not really many genuine concerns about palpitations coming up to the full menopause and that.
I think everyone with palpitations should be investigated. Because,
right. Yeah.
It's important to make sure. You don't want to. It's very reassuring for a person to know that their symptoms have been taken seriously, they've been investigated appropriately, and they have a structurally normal heart. And sometimes just that reassurance gets rid of the palpitation. So I would never see a patient and say, oh, it's just the menopause. I would always say, well, let's have a look. I don't think it's going to be anything, but I want to do my bit and make sure it isn't, and then I can reassure you. Once in a while, you will get heart rhythm abnormalities. So, you can get supraventricular tachycardias, atrial fibrillation. You can get all those in that group as well. But they're generally a minority. And in those people who have it, their overall risk is guided by their age and their comorbidities. So it isn't like if you have atrial fibrillation and you're 50, that is not the same kind of atrial fibrillation as a 75-year-old who has diabetes and 2 previous strokes has had. The risks are different. So I like to reassure patients that actually, even if they were representative of a heart rhythm disturbance, that is not automatically a death sentence by any means. The majority of heart rhythm disturbances are benign, and the vast majority are easily treatable. And you treat them largely for their symptomatic impact rather than their prognostic impact. But it's nice to see what they are and make that assessment based on what you have and the patient in front of you.
So I'm running out of things to ask you now. I mean, I really, sometimes a woman in the group will say, I can't exercise because when I start exercising, my heart rate really goes mad and it scares me and the rest of it. And sometimes I will say, maybe, you could see a doctor and get a beta blocker for that or something. Do you think it's a good medicine for women our age?
I think it's always nice. I think there are far better medicines out there, which are actually just engagement, empathy, education and empowerment. A lady can come and speak to a cardiologist and talk to her about her concerns, and a cardiologist could exercise her in front of him and show her that nothing bad's going to happen to her. And that, to my mind, is far better than just giving them a pill, because rarely does a pill solve everything. But reassurance does, knowing, being with someone who is interested in you and who is willing to take you as a whole person and put all that in context is really important. Sure, beta blockers work, but they also have side effects. They can make you feel tired, they can make you feel cold, so in that sense, yes, it's an easy fix.
Quite a few of us want to feel a bit cooler, actually. That's not such a bad thing. But I wondered as well, because it has this dual aspect of helping with anxiety sometimes, that it might not be such a bad medicine for some of us.
Sure, absolutely. I mean, if your symptoms are crippling and you've done all the other things and you don't feel reassured, or even despite the reassurance it's crippling you, then anything that improves your quality of life, to my mind, is worth doing. Because ultimately, what are we waiting for? What are we saving it all for? We need to be out there enjoying our lives when we have the ability to, and therefore everything is reasonable. It just depends on how troubled you are and what kind of stages you've gone through. If you've been reassured but it's still not working, beta blockers have a symptomatic role. They work as anti-anxiolytics. They stop the heart racing, and for lots of people, they give them some ability to function in a better way than they could.
Yeah. So we did kind of address the other questions that I was going to ask you, which was, can HRT help to keep your heart healthy? But I think you kind of said that it really wasn't worth it for most women. And I was going to ask you, what effects do the hormonal changes in menopause have on cardio health? And what did you say about that? I think you said mainly it was the postmenopausal group, didn't you?
Yeah.
What can we do to stay healthy at this age? And you're going to say diet and exercise, aren't you? And of course, you really don't want to hear those.
So I think it boils down to, the first thing I would say is lifestyle is important, and living a life of moderation is important. And in terms of that, what I mean is that you don't want to become a monk, because at the end of the day, what are you again saving it for? You need to enjoy your life.
Yes, yeah.
That's the first thing. The second thing is, in terms of lifestyle, there is a lot of emphasis on nutrition and exercise, but very little emphasis on perhaps 2 other aspects of lifestyle, which are even more important. The first being stress and how you handle stress, and the second being sleep. And now, and a lot of people neglect those, because the messages from everyone are exercise and diet, exercise and diet. Sleep is hugely important, as is stress management. Number 3, I think there is a lot to be said for being happy. I think there's a lot to be said for practicing gratitude, because those are the kind of things that allow you to become content in your lives, rather than sort of that idea that actually, and there's a lot to be said for living each day as it comes along rather than worrying, because that really doesn't solve anything.
Yeah, that's very Zen. Living in the now. Yes.
In the now, because at the end of the day, if we have a pandemic, there are so many people who are probably worried about having a heart attack or a stroke, but have actually succumbed to the pandemic. There is no point worrying. The idea should be you get on, you live each day as if it were your last. And the reality is, as long as you do that long enough, one day you'll be proven right. But at least you've had some fun along the way.
Can I just ask you what you think about, do you have any opinion on diets like keto and intermittent fasting? Do you think those are healthful, or?
The problem with diets, from my perspective, is a lot of them work by trying to shock the body. So a lot of them are trying to achieve fast results, and a lot of them require a lot of investment from the patient, and they are generally inflammatory in the sense that in the immediate setting, it's good to lose weight. I think it's good. It improves your quality of life. I have no doubt about that. So if you carry a lot of weight and if you can do something to lose the weight, that's really very good. Number one. Number two, I think people should be allowed to do what works for them. So if they feel that they want to do a diet, then I wouldn't be one to discourage them. I would say, okay, as long as you've done your research, go for it. From my perspective, a lot of diets tend to be inflammatory in the sense that they want to achieve quicker results, and that can be inflammatory to the body.
Yes, I think keto puts your body into a sort of starvation mode.
Yeah.
I don't think these are very healthy for women our age. We need to take it more gently,
Absolutely. I think you're quite right. I mean, I agree. I think, and the other problem with these things is that you have to keep at them. And so a much better way is to modify your portion size, to try and concentrate on making healthier choices with what you're eating, and doing it gradually so it becomes a way of life. So you're not constantly under the stress of having to do something, because again, to my mind, and a little bit of exercise and a little bit of stress management and a little bit of working on your diet and a little bit of sunshine and a little bit of happiness and a little bit of social interaction and a little bit of gratitude and a little bit of self-growth. What else do we need?
That sounds good to me. Last question then. Is it important to treat high blood pressure? I'm always telling women, check your blood pressure, because as we get older, that's when it starts to creep.
So again, this is another one of my favorite subjects, really, because the question is, what are we actually trying to teach? Is blood pressure a number, or is blood pressure a process? If it's a process and the number is just a symptom of the process, then in some way it doesn't make sense to treat the number unless the number itself is going to damage us again in the future.
True. But I tell you, when I get to 130, I start feeling hot all the time and I get headaches, so I know it's a numbers game for me.
But the problem then is that if you were in Europe, they wouldn't say that it was your blood pressure. Because so if you want to treat your blood pressure, you move from America to Europe, and they don't have the same cutoff values for what is high.
Yeah, that's true. Yeah.
Question is your blood pressure high for you? That's the important. High blood pressure is blood pressure that is high for the person whose pressure it is, not compare them to some person that we have no idea, this mythical figure with a perfect blood pressure. Who is he? Who are we comparing it to? And why do they change him every so often? And so my definition of high blood pressure is blood pressure that does you harm. If it's not doing you harm, then it's not high for you. Now, if you say to me, when my blood pressure gets to 130/90 and I feel unwell, then and when I lower it, I feel better, then that number is high for you. And it makes sense. It doesn't really matter. We don't have to be reliant on definitions. But For a lot of women, you know, there is this element of white coat hypertension, this idea that you go to a hospital, someone starts talking about blood pressures, they measure the blood pressure is going to be high. Next thing you get plonked on medications. Next thing, it affects everything. The medications cause side effects. Then you go back, your blood pressure still goes high because you're again anxious, and then you get put on another medication. So before going down that, I think the first thing I would always say to anyone is, if you're worried about your blood pressure, because blood pressure changes all day long, right? Everyone's blood pressure changes all day long. So the question is, if you've got so many different values, which value do you use to decide whether your value is high or not? And the answer is, you use the value that has been shown to be predictive of the bad things that might result, or the things that we're worried about. That's
So
the value.
how does it change all day? Is it lower in the morning and it gets higher all day, or what?
Depends on, I mean, when you're asleep, your blood pressure will be lower compared to when you're higher. When you're stressed, your blood pressure is going to be higher than when you're not stressed. If you have a hot shower, you're going to have a slightly lower blood pressure than if you have a cold shower. It changes all day long. The question then is, well, of all these numbers that you can measure in a 24-hour period, which number do you rely on? Which is the most predictive of bad things happening? Because the only reason you're treating it is because you don't want bad things to happen to you, strokes, heart attacks, etc. So the question then is, well, what is the number? Which number should you use? Should you use a 9 o'clock in the morning number? Would the same apply to a person who's a shift worker who goes to bed at 9 o'clock? How do you work it? So we can be far more sophisticated than the current way things are being done. The answer is, the most predictive value is a 24-hour average, meaning that you get strapped to an ambulatory blood pressure monitor. It measures your blood pressure every half an hour during the daytime and every hour at night. And then it produces an average. And that 24-hour average sort of evens out all the peaks and troughs throughout the day and night. And that gives you a much more representative value of whether, you know, what your numbers are. That's the first thing. Actually, research has progressed even further, because now what they say is your nighttime average, which is the most predictive of bad things happening to you. So you have a 24-hour blood pressure monitor, and you measure the average during the night when you're asleep. That is the most accurate value. And if you treat that value, that's where you will get the majority of the benefit. And actually now there was an interesting study, what was it called? Gosh, Hygra chronotropic study, where they took people, they found this high nighttime blood pressure, they made them take their blood pressure tablets at night. And those people did significantly better in the long run.
Yeah, I did hear to take it at nighttime actually, so it must have been something to do with that study, but I never read the study. So yeah. Okay, well, thank you very much for talking to us. Maybe we'll speak to you again soon.
Thank you.
All right. Thank you very much.
Take care. Bye.
Bye-bye.
Bye.